See, this is the app on the computer, and I'm measuring from approximately the occlusal reduction level to the tip of the tooth, and that's about 19 millimeters. So you want a general idea when you use the app to measure. And here's my wisdom tooth that I'll be extracting later on. So both of these, both the mesial and the distal, of course I have two canals in the mesial, one in the distal, are between 18 and 19 millimeters approximately. These are the endodontic supplies I use when I'm performing endodontics. This scalp file is invaluable if you've got tiny little sclerotic canals. Fabulous for finding little tiny canals. Then I'll usually go with a 35, which is a green one, just to open up the coronal part of the canal a bit. Then I'll use a K file, a number 10 K file, and curve it. Or you can use a headstrom file. I'll use a headstrom file normally because it cuts better, but you can use a K file or a headstrom file. Access the canal, hopefully, to the apical part, and then I'll use the canal measurer, and it tells you how close you are to the apex. You want to be about 1/2 millimeter from the apex of the tooth. Then I'll come back and usually go with a red file once I know the length of the canal, and I'll clean that to the apex, or within 1/2 millimeter of the apex, then go to the blue one, back to the green one. I may go to the black one. Usually I don't go past the green one unless, which is a 35, unless it's a real big canal like an anterior tooth or a molar, maxillary molar palatal canal, or a mandibular molar distal canal, especially in a young person. Then I may use this one, the XP3DS, which is curvy, and it cleans it out to a size 30. Remember, it's not the gutta percha cone that seals the canal, it's the sealer. The gutta percha cone compresses or moves the sealer into all the little particles, all the little areas of the canal. So I'm just going in real lightly just to open up the coronal part of the canal. And I'm not putting any pressure, I'm just putting it in until it catches and pulling it up. You want to open up the coronal part so the irrigation solution can get into the canal. Now this is 3-to-1 water to sodium hypochlorite. I'll say that again, 3-to-1 water to sodium hypochlorite. So it's dilute sodium hypochlorite. A lot of endodontists use straight sodium hypochlorite. I don't. I was taught to use dilute because you don't want to have a sodium hypochlorite accident and it go through the apex of the tooth and damage the inferior alveolar nerve or go into the sinus. So you're not squirting this into the canals hard. You're not putting pressure on it. You're just squirting it into the coronal part of the pulp chamber and letting the rotary files take it down into the canals. But that's why you want to do crown down. You want to open the coronal part of the canal first so it will hold the irrigating solution. It just pools in there, and then when the files go into the canals, it takes this dilute sodium hypochlorite with it. You're not putting it under pressure. Do not put it under pressure, just squirt it into the coronal part of the canal. So it's going to actually be in the pulp chamber. Be sure you're irrigating when you're squirting it in. I'll say I'll just drip it, meaning I'll just drip some in here so that it goes down into the canal with the rotary files. We're irrigating it just to open up the coronal part. Okay, this is the slow speed round burr. Again, just removing all the decay, opening up the canals, direct access. You want to open it up around the coronal part too, so you can get into the canal with your rotary files. And now I'm just stepping up and stepping down. I'm going to go with the red one, which is the 25, and they're opening. Then I'm going to go with the blue one. Now, all I've done so far, I've not tried to get to the apex. I've just tried to open up the coronal part of the canal so I can place my hand file in and get a measurement with, this is called a precision apex locator. It's very accurate. You have to have one of these. And you put the hand file in the canal, and then you put this little connector on the hand file, and it reads how close you are to the apex. You want to be about a 1/2 millimeter from the apex ideally. Reading it in those 3 canals, it's about a 1/2 millimeter. So you're measuring, then you want to curve the file before you put it in the canal. Now, what if it's not getting a good reading? There may be too much liquid in there. And so I'll just take my air syringe and just blow it just to get the volume of liquid out of the pulp chamber. And normally at that point you'll get a good read. But that too much liquid can keep it from getting a good reading. So I'm measuring all 3 canals. See, we're at 1/2 millimeter. It's a little over 20. Now what if you're past the apex, this machine, this apex locator will start beeping, beep, 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 and it'll show black all the way to the bottom. So you just lift it out, however much you think you need to lift it, maybe start with 1 millimeter or so and measure again till it's at 1/2 millimeter. Very precise instrument. So now we're measuring the first molar, and as I'm measuring the canals, I'm filing a little bit just to keep it cleaned out. This is about 18. You see what I'm doing? I'm going to curve this canal before I put it into, I'm going to curve this file before I put it into the canal. You never want to put a straight file into a canal because it'll create a ledge. You want it to go around the curve of the canal, so you always put a curve in it. Now, how do you curve it? You take your small mirror handle and just pull it around the handle, and it'll create that curve. So these are the lengths of the canals measured from the incisal part of the tooth where I've prepped it already. So 31, 20, and 19, number 30, 19 mesial buccal, the other 17. This is a 4-holer and this is 2. Both of them have got 4 canals. Some people do. So I'm measuring to the apex. This should be with about 1/2 millimeter from the apex from the occlusal surface that I've already reduced. I'm irrigating again, just squirting that into the pulp chamber. Okay, now I'm going to go back with a red one, which is a 25, and I'm not putting pressure. I'm just gently going into the canal. You just put, just when you reach resistance, you pull up. See, that's the red one. And I'm irrigating that. That's 25. I want to be sure I've got, just don't push it if it's in a bind. That's when you get a separation. So I've done crown down, meaning I've expanded the coronal part of the canal in the beginning with the 35 file, the green one. Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. This is that one that you, in theory, can do the entire endodontic procedure just with this file. It's the one that was squiggly. I've found that I must use at least the 35, and I'm not worried about spending a little extra money on the scalp file, the files in the holder, and this file. So I'll have all of them. And so I'll open it to a 30 or 35 before I use this one. And it just really cleans everything out. Be sure you're lubricated. Pull it up. Now see, this is that squiggly file. So this is an XP 3DS file. And they market it that you can do the entire endodontic filing with this. I don't do that. A lot of lubrication. Now, knock on wood, I've never separated one of these files, the XP 3DS. I've never separated one of them, but I'm trying not to put much pressure on it at all. I haven't separated many of the other ones, but it will happen. So I've irrigated it now. Once I'm ready to take my trial file or trial cone radiograph, I'm going to irrigate the canals with Sitness Plain in the 30 gauge needle, or you can even use lidocaine. The local anesthetic type is not of consequence. It's the 30 gauge needle, because that fits into the canal without pressure. I just want to lay it in the canals and just irrigate out the sodium hypochlorite that's in the canals or any debris in the canals with the local anesthesia and the 30 gauge needle, and just barely lay it in the canal so you float everything to the top. Then I'm going to try the cones in. These are 30s green, and I filed them to a 35, which is the green one. And now I'm placing the 30 cones in the canals that were filed to the 35. So you want to file about one size file larger than the gutta percha cones. So here they are. This is the radiograph. See, I'm a little short right here, and these join. So this one there, so I'm going to clean that one out a little bit more, go a little bit deeper. You could use a 25 gutta percha cone. They're a little harder to get into the canals though. They're more likely to bend. So I'm drying the canals, and I usually use one size paper point larger than the canal. So if I'm using 30 gutta percha cones, I'll use 35 paper points, and I'll use 2 per canal. Now what if it's not totally dry? I mean, you've got just a bit of dampness or blood on the paper point. We've had many endodontists give courses at our teaching center in Dallas, and they said you feel it. Sometimes you can't get it dry. So you don't want to be sloppy with that. You don't want to not dry the canal, but sometimes it just happens and it works well. So don't not dry the canals, but every now and then you can't get it totally dry. And just what I'll do is leave the paper point in the canal until I'm about to fill it with the gutta percha cone, and just at the last minute take it out and fill it with the gutta percha cone and the sealer. So I'm using 2, see, these are the green ones. We're going to use the blue or the 30 gutta percha cones. So I'm using the green ones, and you want to put the sealer on the cone. You can squirt it just in the top of the canal and take it down with the gutta percha cone when you're placing it. I don't think you want to squirt it all the way to the bottom of the canal because the cone may bind. An endodontist showed us this technique, and this seems to work very well. Squirt it on the cone and then move it up and down in the canal to get it to the apex of the canal. And this is a burner, and it sears the gutta percha cone off at the pulp chamber. Then you're going to compress it, and you can do these one at a time and sear them off one at a time, or you can do them all at the same time. If they're all over each other, I'll usually do it one at a time. Once I've placed all the canals, all the gutta percha cones, and seared them and compressed them, then I'm going to come back with the BC paste and squirt a little bit into the top of each of those canals on top of the gutta percha that I've compressed, just for looks, just because it gets rid of any voids or air in, which is not of consequence, but you don't have any in the canal because you've compressed the gutta percha cone in the primary part of the canal, but you've got that little coronal part, and I want to fill that so there's no void in there. So I squirt just a little BC paste in each one. Now what I'm doing with this one is I'm just squirting some of the BC paste in the coronal part of the canal, and then placing the gutta percha cone through that BC paste and moving it up and down. Remember, there's 4 canals in each of these molars. I'm using the burner and searing it off. Then I'm going to compress it. I'm doing the same thing here, just squirting a little bit. See, I'm just squirting that paste in the coronal part, not pressure. I don't want to squirt it all the way down the canal. I'm going to take it down the canal with the gutta percha cone. So I was taught these 2 techniques. One is squirting it on the gutta percha cone, and the other one is squirting it in the coronal part of the canal and taking it down the canal with the gutta percha cone. Either one of them works. But I'm suggesting you don't squirt it hard into the canal so that the sealer goes all the way to the bottom of the canal, because you may not be able to place your gutta percha cone all the way to the apex of the canal. If you do that, the sealer may block it. So you sear it, then I'm plugging it with these pluggers, then I'm squirting just that little bit of sealer in the coronal part of the canals, coronal to the gutta percha. Then we're filling the void with IRM, and you mix this pretty densely so that you don't want it to stick to your fingers. You can watch this video on how to make IRM. I like IRM for a buildup because it's so easy and it's effective. It sets up real hard. It doesn't affect the set of the final cement, because by the time you've seated the crowns, it's set for several weeks, and so there's no problem with it interfering in the set of the composite cement, the resin cement. That's the Dental Minute. These techniques work, and they work every time.
Are you feeling stuck? You know you have more to offer and you can elevate higher in your dentistry practice, but you just don't know how to do it? Well, great news. DentistryMasterclasses.com is here for you. At DentistryMasterclasses.com, Dr. Cutbirth is offering his greatest work and his best cases. Here's everything included when you subscribe to DentistryMasterclasses.com. You will get incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and the Dentistry Masterclasses, comprehensive cases for study and reference. You will get before and after pictures of Dr. Cutbirth's fantastic restored cases. And guess what? All of this is $40 a month. That's right, $40 a month. This is an opportunity you cannot miss. Go to dentistrymasterclasses.com and subscribe today.